Welcome to Health Source of Portland, Maine. Today's topic, migraine headaches, what they are and what to do. The miserable migraine headache afflicts more than 10% of the U.S. population, including children. Despite this, less than half of migraine sufferers have been diagnosed. Here are some migraine symptoms and triggers, plus tips for reducing the misery. What is a migraine headache? Description. During a migraine, the temporal artery, which lies under the skin of your temple, enlarges. The nearby nerves are stretched and release chemicals. These chemicals cause inflammation and pain. They also cause the artery to enlarge further, creating a vicious cycle. Migraines may also affect the sympathetic nervous system, which controls the fight or flight response. Heightened activity in the intestine can trigger nausea, vomiting, or diarrhea. In addition, the stomach may be inhibited from emptying into the small intestine. This means that oral medications aren't absorbed into the bloodstream. Symptoms of a migraine. Migraine headaches involve chronic, recurrent pain. They can last between 4 hours and 3 days. They are typically described as intense throbbing near one of the temples. The pain often switches sides with each new attack. It can also be located behind one eye or elsewhere around the head. Daily activities such as climbing stairs tend to aggravate the pain. There's also increased sensitivity to light and sound, so that sufferers often retreat to a dark, quiet room. Migraines can also be accompanied by an aura, during which the victim experiences some sort of visual complication. These are usually in the form of flashing, colored lights, zigzagging to one side, or a hole in the visual field known as a blind spot. Additional symptoms can include vertigo, unusual smells and tastes, and mild weakness or paralysis. Headache triggers. A trigger is anything that causes a migraine headache. Typical examples are stress, sleep problems, certain odors, cigarette smoke, alcohol, and even aged cheeses and chocolate. Chemical food additives can also act as triggers. These include aspartame, nitrates, and monosodium glutamate. For some women, the decrease in estrogen during menstruation can also trigger a migraine. How can I treat it without medication? Sleep may be the best medicine. Going to bed and waking up at the same times each day with the right amount of sleep in between is vital. Daily exercise and relaxation are helpful habits. Keep a headache diary to see if you can recognize patterns. Look for recurring foods or activities such as stress, exposure to bright lights, and too many late nights. A variety of non-drug treatments are also available. Biofeedback, acupuncture, and self-hypnosis can help reduce pain and prevent attacks. When should I see a doctor for a headache? If you're experiencing regular painful headaches, begin a journal and note the specifics of each attack, when they occur, what the circumstances were, and how you treated them. Make an appointment with your healthcare practitioner to discuss your situation and develop a wellness plan. Migraine headaches and their accompanying symptoms are downright miserable and often debilitating. Be proactive in your assessment and take action by adjusting your lifestyle, getting professional assistance, or both. Don't become an undiagnosed sufferer. You owe it to yourself to get help. For more information, go to www.maine.healthsourcechiro.com/city/Portland-Northwest.